The Family Foot and Leg Center.
At the Family Foot and Leg Center, we keep you walking.
Patients want to come see us here because we care about our patients.
The newest advances in reconstructive surgery and technology, including ankle and foot implants, which can give you the gift of walking and eliminate pain.
This is the patient status post 9 weeks revisional forefoot reconstruction surgery. Pre-op, patient had unfortunately had a bad result initially. Presents to office for revisional surgery to stabilize her toes. Fifth toe is floppy, flail, and unable to wear shoes with significant pain and catching her fifth toe. This is the 9 weeks post-op right now. Patient has minimal swelling, hardly any pain. Her toes are realigned, and stability of the fourth and fifth toe was achieved with syndactyly. Second toe revisional arthroplasty, and third toe revisional arthrodesis was done, and revisional bunion was done also to straighten out deformity of the bunion as well as the big toe bone called the proximal phalanx. Well, this is Anne's foot as compared to the x-ray that we've had. This is at 9 weeks post-operatively. So you can see the toes are nice and straight, the hallux nice and straight, the bunion is corrected. This is from the previous x-ray. Now, from a patient perspective, was it scary undergoing a second surgery, revisional surgery?
Yes, it was a little scary, but I made sure I picked my doctor wisely this time. Went online, read some testimonials, and turned out great. This is before Cariflex. Patient's a diabetic. Treated with topicals. As you can see, we're halfway through, but we're going to finish it up today with the Cariflex procedure. We're going to transform all 10 nails today, and we'll see the results. So this is right after the procedure. Suffering from onychomycosis for how many years?
Oh my goodness, 45.
And you were ashamed to wear sandals. Now,
yes.
Now you're good to go.
Yes, I can wear high heels.
A 68-year-old Caucasian female with a history of posterior tendon tendonitis with tendon tear and collapse of the foot. Notice status post triple arthrodesis done in April. Now we are September, mid-September. Patient walking in a cam boot with very little pain. Scars have all healed wonderfully. Edema is very minimal. This is late in the afternoon. Again, the scar from the triple arthrodesis. Now, how's your experience been?
It has been absolutely wonderful. I haven't had any pain, hardly. I mean, it's so minor, and after I got through the initial surgery for the first days of the pain, then after that, hardly anything. And when I went to therapy, when it was time to go to therapy, I went 9 times, and I didn't even feel like I needed it. I just feel great. And when I first came here for the first appointment, I was in so much pain, and that was just seems like so long ago. None at all.
Great. Would you recommend the surgery to other people who require this?
Very much so. Very much. And the neat thing was I trusted Dr. Lamb, and have no qualms whatsoever. I'm just so enthusiastic about him and his staff.
Well, your alignment looked awesome, ma'am, and beautiful. Well, this is status for triple arthrodesis at 5 months. The patient's foot is rectus and in proper alignment. The swelling is very minimal and no pain, am I correct?
Correct.
And you're walking pretty good. Let's turn around. Let's look at that heel. The heel is probably pretty good right here, the stance. Heel is pretty straight and she's able to come up on her tippy toes, which...
I couldn't even begin to do that before.
Look at that. A couple more raises for you. Good, beautiful. Look at that. Your function is awesome. Months. Okay, it's a patient 2.5 months after ankle scope. Has severe pain upon presentation. These are the scars from an ankle scope. Sir, move your ankle up and around in motion, please. Has the motion improved after the ankle scope?
Oh yeah.
Has the pain decreased?
Yes.
How much has it decreased by?
I'd say 80% what I had before.
Okay. Well, what has been the biggest change that you're able to do now that you were not able to do before surgery?
Well, I'm able to golf 18 holes and rocking and without pain.
Okay. Well, do you have any words of wisdom for someone else that has the same kind of problem and
Get it
contemplating?
done.
Get it done,
Get it
right?
done.
Good. How much pain do you have in there right now?
None.
None. Okay, good. Are you happy with the results?
I am.
Good, good, good. You can show off your foot to all your friends now. You don't have to be afraid.
Yeah.
Okay. Are you satisfied with the surgical results so far?
I am very satisfied.
Okay, good, good, good. Yeah. Excellent. This is the pre-op x-ray of the previous patient that we're talking to. This is the pre-op, and we're going to look at the post-op x-ray today. This is the x-ray about status post 7 weeks now. As you can see, her toe is well aligned, her staples and her screw is well in place. Chose a double osteotomy for better correction as well as better long-term results. Look at the side of her foot right here on the medial side. You can see the skin is right here. The skin is very straight, as you can see on her foot is nice and straight also on the actual person. We're going to go back over here to pre-op x-ray. You see that big lump and bump protruding out the outside. That is resolved, and the patient's doing well, as you've heard. So another success story. 55-year-old female, status post 7 weeks bunionectomy today, Austin and in Aiken. No pain today. How was the post-operative course? Was it better than expected, worse than expected?
Better.
Better. And I know you hear, as well as other people hear all these horror stories about bunion surgeries. Is it true?
No, I've had an excellent experience, and I'm really happy with my results. I would definitely do this again.
Okay, well, that's your scar right there. Is that scar bigger than expected or smaller than expected?
Smaller.
Okay. Well, looking at the x-ray, you've healed up very well. Your bone is about 90% healed today.
Wow.
So, any words of wisdom for people thinking about bunion surgery?
Don't hesitate. Come see Dr. Lamb.
Well, thank you for the endorsement. Status post triple arthrodesis, incision on the lateral.
Look, Dr. Lamb, I can do this. Watch. Look. Look.
The ankle's doing good. The triple arthrodesis is solid.
Look.
How's everything going with that ankle? Not too much problems, huh?
How you like that?
Very good, very good. We'll fix those toes one day. But how was your experience with the ankle surgery? Good?
What?
How was your experience with the ankle surgery?
This foot is, you're a miracle, man. Now,
Let me see you stand up on that.
now watch.
Good, good, good. Okay, good. Well, you're no longer walking
See,
that.
now I have two good feet.
The therapy.
Going for therapy helps. Good.
Definitely.
Well, this is the before X-ray. Notice the subchondral cyst in the ankle joint on the mortise view. This is today's view with no pain as previously stated, and patient's doing well. We're gonna take another look back over here at the AP view. Note the subchondral cyst and narrowing of the joint. And we go back and compare the AP view of today. This is about 6 months post-op. Okay, this is 79-year-old female with an ankle fusion. Just that is post 2 years. No pain around the ankle at this point, am I correct?
Yes.
Great, great. This is a result of an arthroscopy gone bad. So, had to fuse the ankle due to severe pain and debility. Patient currently is able to walk how long now for exercise?
3 miles.
About a day? You walk more than me. She's able to walk 3 miles a day now. And the motion of the ankle is excellent. Push down, pull up, and around in a circle again. Perfect, perfect. The fusion involved cutting the fibula and using it as an onlay graft. There's no pain or swelling about the ankle, anteriorly, medially, or laterally. The motion is excellent. This is one of our favorite patients here with a joint implant about 3 years ago.
Oh, yeah?
Yeah, that's you.
Me?
Yes. And today here she's followed for a toe fracture, but we just want to take a look at the joint right here. See how she's doing, and the joint looks good, great on the x-ray. And let's take a look at the patient's foot, see how it looks. Okay, awesome, awesome. Range of motion is perfect. It used to be stuck before surgery. No pain, scars hardly visible. How was the surgery?
Surgery was falling off a log. Nothing to it.
Nothing to it. So 3 years ago. So how was the pain afterwards?
Minimal. Don't remember very much about it.
Are you happy you had the surgery done?
Oh, absolutely.
Big difference.
A difference.
A huge difference.
Huge difference.
Were you scared before surgery?
No, I wasn't too scared. I had confidence in the doctor.
Well, thank you.